case, again, this history, loss of weight, routine hemogram report, if you see, everything is very in favor of tuberculosis, because this is India, we have to think of tuberculosis first. This anemia, then this reversal of globulin ratio, then again it's very highly, then ultrasonographic results of multiple lymphadenopathy is highly suggestive of tuberculosis. But if you see carefully on the paper smear, in this case, if you have the diagnosis, unless you have the diagnosis, then only we can see the paper smear with that angle. Otherwise, we are not going to see at all. Unless your mind knows, you cannot see it. This is called in pathology. So, if we have the doubt in mind, maybe a tuberculosis, maybe a lymphoma with lymphadenopathy, then you go for carefully the paper smear. If your paper smear is highly suggestive of lymphoma, I told him you have lymphoma, you go for biopsy. Because I know in the paper smear there are occasional sporocytes, which I thought this could be DCT positive. Then I told the lab superintendent you do DCT, and there was highly strongly positive, because the lymphomas, 30% cases lymphomas, they have this autoimmune phenomenon. So with this, we can suggest this patient has lymphoma. But to conclude lymphoma, again, if you have in mind, the patient may have lymphoma, if it clicks you, don't wait for the FNAC, don't wait for the FNAC report, you straight away go for the biopsy. Because lymphoma is one condition where you require biopsy. All this immunohistochemistry, cytogenetics, everything can be done from the biopsy. So if you have in your mind, maybe patient, maybe a case of lymphoma, straight away you go for biopsy. This is now rule of thumb is considered, you go for straight away for biopsy. Don't waste time for FNAC and everything.
In this case, some metted, the lymph nodes were metted, no?
No, there was no peripheral lymph nodes.
So that goes against tuberculosis.
That's why they have done biopsy from under GA. They have done from retroperitoneal lymph node.
मैडम एक केस मैंने भेजा था आपको, उसमें आपने लिखा था रिएक्टिव लिम्फोइड हाइपरप्लेजिया, ठीक है? पेशेंट को एंटीबायोटिक दिया बट रिजॉल्व नहीं हुआ, अब उसका क्या करें?
You go for biopsy. Always I advise Niche, if you think clinically and after the treatment patient is not resolving, always you go for biopsy. Because see, lymph node is one structure. Suppose this mental cell lymphoma, okay, lymph nodes are, the submental lymph nodes are very small, that is okay. But if you see the pattern, there was nodular pattern, there was just increase in mental cell layers, or it will be diffuse. So suppose your needle hit the normal follicle, you will get reactive lymph nodes. So you won't get, because the needle is picking just some area. Unless the lymph node is diffusely replaced. If it is focally replaced, then you won't get pathology. You will get a reactive lymph node. So if you have in doubt, the patient is not responsive, always go for biopsy for lymph node.
दो तीन केस है जो रिजॉल्व नहीं हो रहा है,
Biopsy.
Always you go for biopsy.
बुलाया एक महीने बाद बुलाया.
And
Biopsy is the answer.
if I have some doubts, sometimes materials is small, maybe I am not that sure, I advise for biopsy. That is also the way I write. If you have doubt in my mind, I always write biopsy. If I don't write biopsy, then I will see the clinically the patient, whether it is lymphoma or not. If it is not, again you go for biopsy.
रिपीट FNAC का कोई रोल नहीं.
No, no.
What is the limitation of FNAC because of this small tissue?
Yes.
Tissue whether it is correct.
95% FNACs are accurate. 5% I'm not saying. Wherever you have doubt, you go for biopsy because that is best.
Thank you.
Give the proper side.
Thank you, Dr. Mahamaya Sharma, for your nice presentation. And last presentation.